Test 1 2, test 1 2. Test 1 2, testing 1 2.
different species would we have weasels? Weasels.
Sorry. Due to the governor's executive order, masks are required at this meeting in any school. There are masks, I think, somewhere in the back, so I'm going to have to ask you please put them on before we start our meeting. Thank you. I just want to be clear, I don't see anybody moving. We will not start until everyone's wearing a mask. Thank you.
Thank you.
If you're not going to wear a mask, you're going to have to leave. I apologize. It's the governor's executive order that takes precedent here.
Yep. Thank you.
I think we're down to just 2 people at this point, so if those last 2 could please wear your masks, we'll be all set to go. Okay, thank you, folks. So we're going to get started. I'm going to call the meeting to order. Today is August 24th, 2021. This is a business meeting of the North Kingstown School Department and School Committee. If I could ask everyone to please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. And Madam Clerk, if you could please call the roll.
Greg Blasbach.
Here.
Lisa Hildebrand. Here. Jennifer Hoskins. Here. Jennifer Lima. Jake Mather. Here.
Thank you. And if you could call the calendar.
Tuesday, September 14, 2021, School Committee Business Meeting. Tuesday, September 28, 2021, School Committee Business Meeting.
Thank you. And one thing I want to make a point, I want to apologize. At the last couple of meetings, we were having some issues with our provider that provides the streaming services and the recordings of our videos. We're hoping that we've gotten through those glitches, but just in case, we're actually running 2 cameras tonight. So if anyone is at home and has any issues, if you go to the NKSD .net website, there will be a pop-up, sort of like when there's a school closure or something, that will link you to a YouTube stream, so that we're doing this 2 different ways as sort of a belt and suspenders backup, just in case there are any issues with the recording from our normal provider. So I just wanted to make that point. If there are any issues with either stream, you can switch between the 2. We want to make sure people at home are able to see. So next item on our agenda is a presentation from Dr. Auger on the masking policy and COVID protocols for the upcoming school year. And we're going to have a screen come down, so the school committee is going to go down there so we can see and not get hit in the head by the screen.
Ms. Berganza, we have Sally Schott, the Jamestown representative. I just want to make sure she's recognized being here tonight. Thank you, Chaz. So good evening, everyone. Check 1, 2. Okay, we're here. So thank you all for coming out tonight. I know this is not necessarily an issue that there is universal agreement on. It is clear about that. So I want to walk you through my presentation tonight, and that has to do with the policy proposal that is before the school committee and the protocols that I expect to be adhering to as we move forward. And I also have Dr. Howard Silversmith here with me. Dr. Silversmith is a pediatrician, and he is hired by the North Kingstown School Department as our go-to person on medical matters, and I've asked him to speak tonight before this presentation is done as well. And that will happen at the end of my remarks. So I want to start by saying, as you all know, the governor has made an executive order, and that requires masks in schools. That is what is happening tonight. That is what is happening going forward until the governor lifts that mandate. LEAs are required. LEAs that have not adopted a universal indoor masking requirement shall be required to abide by a universal indoor masking protocol developed by the Rhode Island Department of Health. The Rhode Island Department of Health protocol shall require universal indoor masking for all students ages 2 and older, staff, teachers, and visitors to K-12 schools. That is where we are. That is where I expect we will be for some time. I don't know when that will end, but when there is an executive order of that kind, superintendents and school committees are bound by law to follow them, and I will be doing so. The proposal that I'm going to put forward tonight is based on recommendations from the CDC, from the Rhode Island Department of Health, Rhode Island Department of Education, and the Rhode Island chapter of the American Academy of Pediatrics. So on 8/4, this is all this month, the CDC given new evidence on the B1617-2, the Delta variant, CDC has updated the guidance for fully vaccinated people. CDC recommends universal indoor masking for all teachers, staff, students, and visitors to K-12 schools, regardless of vaccination status. Children should return to full-time in-person learning in the fall with layered prevention strategies in place. The RIDE and Rhode Island Department of Health have basically followed that. This was from August 3rd. Indoors, RIDE, in partnership with Governor McKee and the Rhode Island Department of Health, is now strongly recommending that districts implement a policy requiring every person in a school setting to wear a face mask indoors, whether vaccinated or not. And for outdoors, on the same guidance, in general, people do not need to wear masks when outdoors. However, particularly in areas of substantial to high transmission, CDC recommends that people who are not fully vaccinated wear a mask in crowded outdoor settings or during activities that involve sustained close contact with other people who are not fully vaccinated. To me, that describes a typical playground at a typical elementary school. That is why the guidance that I am proposing includes recess in this for substantial and high transmission. Excuse me. Please, no interruptions. You need to wear a mask. Ma'am, you need to be wearing a mask. In an August 8, 2021 statement from the Rhode Island chapter of the American Academy of Pediatrics, universal masking, a significant portion of the student population is not eligible for COVID vaccination at this time, so universal masking protects the unvaccinated and reduces transmission of the virus, which is most important given the continued concerns for variants such as the Delta variant that are more easily spread among children, adolescents, and adults. So putting that all together, again, I want to start, this skips a little bit ahead in our policy, gets to the exigent circumstances. This part basically says, and I'll skip right to that yellow section, in the event of any mandatory order is issued in this regard, or in the event that there's a spike in our schools, that this would give the superintendent the authority to make changes, but in that last line or two, would forthwith amend this policy as necessary to update the district's response to COVID-19 pandemic and to conform with all such orders. So it's built into our policy that if the governor makes a mandate, that in effect is our policy. What I've recommended, and you've all gotten this in the mail, but I'm going to walk you through it anyway, is that on the front page of the RIDO, the Rhode Island Department of Health data page for COVID, they list, and I will show you this in a moment, in big, bold colors, low transmission, which is 0 to 9.99 cases per 100,000 population. Moderate transmission, which is 10 to 49.99, substantial, which is 50 to 99.99, and high transmission is anything over 100. The policy proposal that I am making is that if we are in periods of low and moderate transmission, that it would be strongly recommended but not mandatory that all individuals wear a mask covering when entering a district facility or attending school. To my knowledge, we were in that period in very late June and early July. And since then, it has climbed significantly out of low and moderate range. During sports and related activities, all athletes must follow the athletic guidance of the superintendent, which is informed by the Rhode Island Scholastic League and the CDC. So right now, many of our sports are not requiring a mask outside. There will be for indoors where masks would be required. And there may be some cases where that sustained close interaction may be taking place where the athletic director and I may make a determination that there would be masks during those particular periods. And masks and face coverings are required to be worn by everyone on a bus during school bus transportation. That is a federal order. That goes even beyond Governor McKee. For substantial and high transmission periods, this gets over the number 50. During periods of substantial or high transmission in North Kingstown, all individuals are required to wear a mask, face covering when entering a district facility or attending school. Students and staff are required to wear a mask during recess, crowded outdoor settings, or during activities that involve sustained close contact with other people. All visitors to buildings are required to wear a mask covering before entering a district facility. Now, what I just described to you in these last two slides is a moot point at the moment because the governor has mandated all will wear masks, regardless of whatever color we happen to be in at the moment. So this is the link for that page. I'm going to get out of this slide for a moment, and I'm going to come to show you the page where I will be making my decisions from. And here it is. Okay. So at the top of this page, and for the record, this is the Department of Health COVID-19 response data. And you can see that number. And you can see low transmission, moderate transmission, substantial, and high. Right now, the state of Rhode Island is at the number 173.5. That, as I mentioned, has climbed significantly over the summer. If there's any good news here, it is that the number is down about 10 since the last time I saw this 2 days ago. So maybe that's a good sign. Hard to say. It is also tracked weekly. You can see here, around July 3rd, that number was 12. The week ending August 21st, the number was 195. What I am proposing is not a Rhode Island number. It will be a North Kingstown number. And so on the same page, and you can do this at home. If you get cell reception, you can do it right here tonight. You can see that the light blue is the state of Rhode Island. The purple is North Kingstown. In most cases, North Kingstown is a little bit lower than the state in terms of the transmission per 100,000 people. However, if we scroll right to the very end, so that number that ends the week of August 14th, now this could change as we speak because they changed the numbers on Tuesday night. So sometime tonight this number is going to change and you're going to get the number for the week that ends August 21st. But as you can see, the North Kingstown number now is at 237 and Rhode Island's is at 155. But as I pointed out earlier, you scroll back to the top of the page, the number is like 176 for today. So you can see it's a little complicated to keep track of these numbers and to keep track of the date that they report the numbers. But these are the numbers that I would be looking at. How bad is the coronavirus rate of transmission in our community? That's what I'm going by in this policy. So I want to talk about related protocols. So in schools, all NKSD schools will have bus schedules and school start and end times similar to pre-pandemic conditions. Davisville Academy will follow the high school start and end times. The odd thing about Davisville Academy is they had one schedule for their elementary and one schedule for their high school. Not that many students, about 30, but just want to be clear with them that we are at a point where we can make it one schedule for that entire school, so that will follow the high school start time. But that has nothing necessarily to do with the coronavirus. The North Kingstown School Department will have pre-pandemic conditions regarding class schedules. Lunch periods and locations may vary due to school logistics. Schools will strive to create at least 3 feet of social distancing at all times, as much as possible when indoors. Layered mitigation measures, including wearing masks, ventilations, hand washing, etc., will be in place to increase safety in all settings. And I refer here to the school committee policy that is on the table tonight. To monitor students, we will no longer have a screening tool found that the usage of that was kind of spotty, particularly the longer we went into the period of using it. So parents and guardians should monitor their children for symptoms of infectious illness every day through home-based symptom screening. This approach relies on students and their caregivers to identify when the student might have symptoms of infectious illness, to take actions such as staying home and potentially consulting with their health provider. Students and staff who are sick should not attend school. School nurses will isolate students who exhibit symptoms in school and will contact parents and send students home to receive COVID testing and to begin quarantining when necessary. We'll talk a little bit more about COVID testing coming up. Here it is, COVID testing. So we will not perform symptomatic and asymptomatic testing for COVID-19 in schools or in the athletic program unless conditions warrant it. So for right now, we don't believe the conditions warrant it, and we are fortunate in North Kingstown to be the home of a testing site that has been up through the entire COVID, ordeal, and that's at the Wickford train station. So we will utilize that. We will also make recommendations that if people feel, that they should be, seeing their doctor to get this testing done, that's what they should do. School visitors. They may enter the school building consistent with pre-pandemic conditions, but they must comply with our masking protocols. Busing and student transportation, there's no capacity restrictions on school transportation for the fall. It makes it easier for us to run our schedules the way we would want them. And it is recommended that household members sit together in the same seat when possible, but masks are definitely required on buses. Again, that is a federal order. Now, this is an important point. Quarantining from the Department of Health allows for a couple of options, and they recommend the option that is the least disruptive, which is 7-day with testing quarantine option, which is what we will follow. But that middle section is really key. A K-12 student exposed to another K-12 student infected with COVID-19 does not need to quarantine if all of the following apply. And this is a big argument for why we should be wearing masks, everybody. K-12 student exposed to another, both the infected person and the exposed close contact are K-12 students. The exposure occurred in an indoor K-12 classroom, and both the exposed close contact student and the infected student wore face masks at all times during the close contact exposure, and at least 3 feet of physical distance were maintained at all times during that exposure. So we will have, still to do some contact tracing and to figure out if these things are occurring. Having a mask on helps the process. Keeping 3 feet apart helps the process. This is the way that we can keep kids in school. And this is going to help in a huge way. Remember last year, and even before that, how we were not happy. Everybody was not happy with how much we had to stay at home. And then when we did get back to school, we were not happy with how much one sick person in a classroom may mean for that entire room or a good segment of that room to have to go home. That disrupts families. It disrupts your parents' schedule. It's not good for the kids to, be zooming in and not present. So we want to avoid that as much as possible. This, right from Rhode Island Department of Health, really helps us. And something that you don't see on your slide, but I see on mine. If you have probable symptoms, but they're not connected to a positive COVID contact, that would require a simple negative PCR test to return. So someone's exhibiting symptoms, but we don't believe it's linked to sitting next to another child in school. So the North Kingstown School Department will make adjustments to these protocols as needed and in the best interest of the health of students and staff, and any updates will be communicated via email by the district and school. So this is a starting point. And the Department of Health has informed us that they're doing the same thing. They continually look at the data. This has changed dramatically just in the last month, changed dramatically within 2 hours before I hit the send button on this policy to all of you, where the governor made his mandate. So, more is coming, hopefully, less restrictive because more people are doing the right things and the rate of transmission is going down. Right now, we're going the wrong direction, however. So I don't know if that's going to happen all that soon. Dr. Silversmith?
Hi, I just want to start by introducing myself to everybody. Some of you know me, most of you probably don't. My name is Howard Silversmith. I'm a local pediatrician. I have an office in East Greenwich, Rhode Island. I've been there for over 20 years. I'm a North Kingstown resident. I've been here for almost 20 years. I have two children who, one has completed his entire course of education through the North Kingstown school system, one who is going to be a senior this year in high school. I've coached many kids in this community for lacrosse, for youth football. I am very invested in the children of this community. That is the only reason I am here. That is the only reason that I'm the consulting physician for North Kingstown. I have no political aspirations. I have no strong ties to government organizations. I really just feel that I've dedicated almost 25 years of my life, which is half of my life, to trying to make sure that your kids are safe. That's all I care about. And it really is, and I hope everybody understands that. The next thing I really would like people to understand is I don't like masks. I went into pediatrics because I like to see kids' faces. Nothing makes me happier than walking into a room where a kid has a giant smile on their face. I haven't seen that in my office in a year and a half. I hate that. I know teachers hate it. I know parents hate it. I need to start with that premise. I don't want to see kids in masks. In the last 2 weeks, I've learned a ton after speaking at the East Greenwich School Committee meeting, having people call in to radio stations, bad-mouthing my name as a public servant, as a physician, and it's hurtful. I have to admit that. It is. So my feeling is I'd like to take a completely different approach when I talk to you guys tonight, and I'm really asking you humbly to understand why I strongly believe that children need to be in masks to start the year. None of us are wearing masks to protect ourselves. I see very few N95s here. I wear one pretty much all day in my office. I see COVID-positive patients in my office almost every day. I'm in an N95, I'm in goggles, often a face shield over those goggles when I'm highly suspicious that somebody has COVID. That is to protect me. Today I'm wearing a cloth mask to protect everybody else here. I know I've been exposed to COVID in the last few days by positive patients. Again, I was protected, and I feel confident I don't have COVID, but I'm wearing a mask to protect everybody here. And that's all we're asking of you to do with your children, to protect those around them. In the last week alone, I'm only going to mention 2 phone calls that I've gotten. One was from a mom who has breast cancer and has 3 kids in a local school. And she's terrified to send her kids to school. She's terrified. The governor's mandate has eased her mind and eased mine, where I've tried to reassure her that kids will be masked. Another is a high school student with a neuromuscular disorder who has been twice vaccinated early on. But that mom is terrified to send her child to school. She understands the risks that she is taking in sending her child to school. So when we ask you to mask your child, it's not to protect them. I know it's your kid. It's your choice to protect them. But we're asking you to protect others. And we're asking you from a spot of kindness for those people, not because we want to see you masked, not because we want to have authoritative orders over you and your children. It is really just to protect others. And that's the point that I feel like we need to get across. I'm not going to debate whether or not masks work. I understand that there are very strong feelings about that. But I think all we know right now from looking at the South is not wearing masks doesn't work. So whether you believe masks work or don't, I know I'm not going to convince you. But we know that not wearing masks doesn't work. We have 1 children's hospital in this state. They do not have a lot of beds. Unfortunately, most of those beds are used up by psych patients. We don't have a lot of beds. There are already plans to reopen field hospitals for adults. We don't have field hospitals for kids. We don't have a lot of ICU beds in this state. All we know is what's happened in the South over the last month. All I'm asking is give us a month, give us 2 months. I don't know. But let's see what masks do. If you don't believe in it, then we're probably going to see that we're overrun anyway. I do believe in masks. I do believe it'll make a difference. I do believe we can protect our kids. And please, if you don't want to protect your own because you don't feel that they need to wear a mask, please just consider protecting the other children who have cancer, the other children who have immune problems, teachers who are at high risk. And again, please understand, you are sending these kids home to parents, to grandparents who are also high risk. So I'm just going to end by humbly please asking you, just start with a mask. I know you don't want to. And let's see what happens. Let's not be the control group. Let's be the group that actually takes intervention and tries to prevent it.
Thank you, Doctor. So I will conclude by going back to where I started. No matter what happens tonight with a school committee vote, the governor has an executive action in front of us, and that is essentially the policy of the North Kingstown School Department tonight and going forward into the school year. This policy, I'm sure there will be a number of people who have comments about it, and I'm sure the school committee will have some discussion about it as well. It can be amended, it can be passed, it can be re-looked at again in the future. And I would not doubt that that would happen. But for the time being, as I said, the governor's executive action, supersedes this. What would happen is if we get to a low enough rate of transmission where the governor finally gets to a point where he says, I no longer have a mandate, then some of the details about low transmission and all that would start to kick in for us as well, where there would be a choice. But until that happens, we would be wearing masks. And I want to remind people, I see people who are not wearing masks right now, you have to wear a mask or you need to leave. Thank you. Was that? Can I plug?
Okay, so now that I'm facing the crowd, unfortunately, as Dr. Auger mentioned, we've got some people who've taken their masks off. You have to make a decision this evening. You can stay and wear a mask, or you can leave and not, but we can't proceed while people aren't wearing masks. And if we have to recess our meeting, we will do so. I'm trying to get you folks to help us here. Make a motion for a recess. Do I have a second? Second. All those in favor? Aye. The school committee is in recess. Folks, you have a choice. You can leave so that we can continue our meeting, or we will not be able to continue our meeting. So please have your masks on soon. Thank you. We're in recess. Doctor?
Afraid to bring it into my office. I'm terrified to bring it into my office.
Doctor, we're going to try to get going again if you don't. I'm sorry, I don't mean to interrupt an impassioned plea. All right, so as we mentioned before, pursuant to the mandate issued by the governor, masks are required in schools. At this point, I see one person and one person who's not wearing a mask. I would ask that you please put your mask on so that we can continue. Okay, so right now, I think everyone is wearing a mask again. I thank you very, very much. So we'll get on with our agenda. So I'm going to call our meeting back to order. Chaz, are you need a minute? Thank you. Okay, so we have reached citizens' comments. So I have a list here of the people who've signed up. If you would like to sign up and have not already, you can still put your name on the list down there. So I'm going to call the first person. It is Richard, and again, if I say someone's name wrong, I apologize. Richard Palsino. We do ask that you please limit your comments to 3 minutes. And I have my timer here. If it starts to flash red, that means your 3 minutes have gone by. If you could please state your name and address for the record, each of you, when you speak.
Richard Palsino, 7 Whipple Road, Smithfield, Rhode Island. This year I'll be entering my second decade as an English teacher here at North Kingstown High School. I speak here today not to be intentionally antagonistic or as a representative of any particular political party or ideology. I speak in the interest of young people and the academic tradition of critical thinking. No one group, person, book, thinker has all the answers, and when it comes to solving problems, we must ask questions, debate openly, and consider multiple viewpoints. As it relates to COVID-19 and that problem and an imposition of a mask mandate at North Kingstown High School and throughout the district, I hope the following considerations have been made. Some numbers. With COVID, it's important to think not just about the number of cases, but how individuals with the virus are faring. We know some people have no symptoms or mild symptoms. This information from the American Academy of Pediatrics, they collect mortality data from 43 states, New York City, Puerto Rico, and Guam. They showed in their most recent collection that children accounted for 0 to 0.2% of all COVID deaths, 7 of those states reporting no deaths at all. Of the pediatric COVID cases in those areas, 0 to 0.03 resulted in death. It's a low number considering individuals 18 years or younger constitute more than 20% of our country's population. The CDC reports as of August 20th, 430 individuals 18 years of under have died from COVID. This includes those with underlying diseases and comorbidities. With the 4.41 million children reported to have tested positive, this gives us a 0.009% chance of fatality for a child with the virus. I quote from the AAP as of August 12th, quote, "At this time, it appears severe illness due to COVID-19 is uncommon among children," close quote. Other considerations. How about the long-term health risks of wearing a mask on a young person's developing immune system? The social-emotional risks of signaling to kids that the air is toxic, other people are carriers of disease. Have we considered why it's okay to let technocrats make decisions about schools in which they're not teaching and learning, to make decisions about children that they're not raising? When do we acknowledge decisions about our lives and children's lives are not just health decisions, but moral and familial ones as well? In closing, we face many problems in society. There aren't solutions. There are trade-offs, decisions we make weighing risk and reward, and in doing so we must be wary of advocating for something without any limiting principle to contain it. The concern with COVID measures is there is no limiting principle. Who's to say we're not doing the same thing at the start of next school year, even if more people have been vaccinated? COVID's not going away. Are we to wait till there's a 0.0% chance of risk before we resume our normal lives, or are we hoping for a utopia? People often think utopia means a perfect place, but the truer translation from Greek is not place or no place at all. And I'm proud to be an employee at this school. It's an imperfect place, but it's a great place. My concern is that without a limiting principle for mask mandates moving forward, that this school and others like it could be on a road to becoming no place where young people are comfortable or inspired to learn at all. Thank you.
Thank you. So the next is Jamie Bashant.
Thank you. Good evening. Jamie Bashant, resident of North Kingstown, mother of 2. My oldest will be entering kindergarten this fall at Quidnesset. And I'm here because I'm concerned.
Could you just state your address? Sorry.
55 Yellowstone Drive, North Kingstown, Rhode Island.
Thank you.
Thank you. I'm here because I'm concerned about the mask mandate. And I have 3 points that I'd like to raise tonight. The first of which was just addressed briefly by the person who spoke before me, which is the social and emotional consequences with respect to masking our children. To the extent that masks will be required in the classroom, I hope that there has been discussion about clear masks for the teachers so that the children can see the expressions of their teachers in the classroom, especially our youngsters who are entering a new school for the first time and are expected to charter that brand new territory. And further, beyond the social, emotional, and mental health concerns I have with respect to masking, we have the real academic component of the classroom, especially with the youngsters, which is learning how to read and sounding out letters on a page. And it's really hard to do that if you can't watch the mouthing position of the teacher. So I would hope that there's discussion about potential face shields for teachers, especially with the youngsters, so that in the context of that learning, they can actually see the expressions of their teachers and how their teachers are forming the letters to make the words that they're trying to learn. So I think that's really important consideration to make to the extent that masking is required. The second point I'd like to make is with respect to metrics. It sounds like we're going to be using the metrics with respect to North Kingstown, which I think is great, and we're not going to be reliant on the nation or even the state when it comes to understanding community spread. But considering that there are, I think, very real and negative consequences with respect to masking, the cost-benefit analysis shouldn't necessarily be with respect to just transmission in general, because we know there are lots of asymptomatic cases or cases where people don't get very sick. So considering that there's very negative consequences associated with masking, I think that the metrics should be more related to the severity of the transmission. For example, hospitalizations and deaths should be taken into consideration with respect to that metric and not just positivity overall. I think there needs to be a clearly communicated plan to the community so we see the light at the end of the tunnel, we know what the metrics are, and that they're evaluated frequently and regularly so that there's not confusion and misunderstanding about what's required. And lastly, I think it's very important that we keep using the word mask mandate, but when it comes to our children, there needs to be some flexibility. Masks are not comfortable. We all know that. Our children need to breathe. And as I need to right now, I think our children are going to need to pull their mask down throughout the day. And I would hope that our educators and school administrators aren't utilizing their valuable class time to police our children or scold them for not wearing their masks. And to that end, I also hope that children won't be encouraged to tell on their classmates and friends when they aren't masking properly. I think that's really unfair burden to put on our children. They're trying to foster these new great friendships and relationships. To burden that with so-and-so's not wearing their mask, et cetera, and focusing on the negative, I think is a huge problem. And we should just give their kids the benefit of the doubt that they're trying their best. And I heard Dr. Ajay talk about masking at recess. That just breaks my heart in so many ways.
Now I have to ask you to please wrap up.
Yeah, I think it's, one, grossly unfair to our kids. We want to encourage them to run around, get dirty, exercise at recess, and a mask is a huge impediment to that process. It's not only unfair, but it's unsafe. It's hard to breathe with a mask on. I don't know how our children are going to run around and have fun.
Please wrap up. Thank you.
Thank you. I hope that the school committee takes these points into consideration when evaluating the policy. And again, I just want to conclude by saying I have very real concerns about the mask mandate for our children. Thank you.
Thank you. Next is Anna Conti.
Hi, I'm Anna Conti, 10 Bethany Lane. I want to thank you all for your service, and I know that it's been a challenging year and a half. So thank you for your for always being vigilant and looking out for our kids. In reviewing the proposed mask policy for NKSD, I was at first relieved, with language suggesting that the district would be following CDC and RIDO recommendation. I was pleased that the district would be implementing a policy which would not necessarily meet everyone's political agenda, but sought to do the fundamentally most important job for our students, keep them safe. Upon further reading, I found it disconcerting that in actuality a mask policy for our district was being proposed based on data trends, which does less to protect children than incentivize ignorance for testing. Don't want your kids in masks? Don't get tested and keep the percent positive down for our town. With a fourfold increase in children testing positive for COVID-19 in the past month, now is not the time to recommend a numbers game in the implementation of a mask policy. Based on numbers as of 2 weeks ago, were this policy in place, masking would not have been mandated in North Kingstown schools, and yet more people are hospitalized today in Rhode Island than were hospitalized at this time last year. And while it is true that many children do not present with serious symptoms, children are dying, and they are bringing it home to their families and loved ones. There is no easy answer to the question of masking, and certainly none which will please everyone. But here's what I can tell you from my experience as a mother and a special educator in another district. Children, my 6 and 8-year-old, along with the children I teach, are more successful attending school in person. It has been my experience that nothing has been more disruptive to students in the past year and a half than the constant dance between in-person and online learning that we are seeing in districts in the South which have already opened without universal mask mandates in place. As a parent, it's my responsibility to show my children that sometimes it requires a little bit of discomfort on my part in order to ensure the health and safety of everyone in our community. My students and my children mask up without complaint because we believe in an open, constant dialogue about empathy and compassion. I get it, I do. This is all hard, and the answers don't come easily. But children cannot learn if their health is not our primary concern. All children should be able to attend school knowing that their safety is our priority. I implore you to recommend an implementation of an unconditional universal mask policy for North Kingstown schools for the 2021-2022 school year.
Thank you. Next, I have Kristen Crow.
Hi, can you hear me okay?
I can.
Okay. My name is Kristen Crow. I live at 100 Birchwood Drive in North Kingstown. First, I'd like to thank the school committee for giving us the time to share. This is my first meeting, and I'm honestly terrified to be up here speaking. So please bear with me, and I'll try to keep this short. I'd like to use my time to simply voice my family's support for the mask policy. I have 2 young children. My oldest is starting kindergarten this fall. We know that masks and vaccines work. The data proves this. My children are too young to be vaccinated, and we are relying on masking to keep them safe. Masks are recommended by pediatricians, like the one we heard from tonight. If we're trusting our pediatricians with so many other aspects of our children's health and well-being, why wouldn't we trust them with this? I spoke to a coworker and a friend in Texas the other day, and I told her how excited I was that a mask policy was released. Her response, "You are so lucky. My kids are at school, and it feels like there's nothing I can do to protect them." I know that I will feel much safer for my daughter and for my family if a mask policy is in place. Thank you for proposing this policy and for your time.
Thank you. Next, I have Matthew Blazer.
Hi, Matthew Blazer. I live at 882 10 Rod Road, North Kingstown. As a teacher, last year was difficult in ways that I would never wish to replicate. And I hope that with all the possible variants of COVID-19 that we face in the future, we give grave consideration of the length of time we can continue with any similar precautions. And I do appreciate that a number of the precautions from last year have been lifted. But without the possibility of any scientific data about the emotional and physical effects of these precautions on students, knowing the very small risk that COVID presents to students, perhaps some personal illustrations might broaden perspectives. Last year, while standing at my classroom door between periods, instead of the typical friendly interaction in the corridor between teachers and students, I witnessed students who walked by quietly and avoiding eye contact, which to me indicated a level of fear and distrust I had never seen in school before. It probably also made for fewer discipline issues, but also just felt disconcerting to see half faces process silently past me. In the classroom, students were far more hesitant to contribute, to ask questions, to stay after class, even for a socially distanced conversation. I felt as though I were living in a different place and time, one in which human interaction was feared and discouraged, an attitude completely opposed to what a public school should embrace. It was difficult for me to know who was speaking sometimes when students did share aloud. And by the time I had identified the speaker, it was too late for me to make meaningful eye contact as a good listener. However, over the course of the year, students became more comfortable, and it was easier for me to tell whose half-face was walking past in the corridor. But I'm not sure that what becomes more comfortable is always what's right. Is this what we hear as being called a new normal, something that we just have to get used to? In most of the literature we study, practices that become comfortable, things that characters accept because the loudest voices are insisting on those ideas, are the ones that are ultimately the most pernicious, more dangerous than the problems they initially sought to correct. While I recognize that this coronavirus is something we'll have to endure for a very long time, I worry that by public schools accepting this mandate, we're edging closer to something that is closer to practices in some places in the world, places where freedom is minimal for all but just a few. This is not a new normal I believe we should accept. Thank you.
Thank you. Next, I have Jane Stokes.
Hi, can you hear me?
I can.
Jane Stokes, 71 Morning Dove Drive. I've had the pleasure of talking to most of you already by phone, and nice to meet you face to face. I wanted to say that my family moved to North Kingstown in June. I'm a 22-year military Marine Corps vet, and we were happy to make North Kingstown our home. We're excited to return to this area since we moved here last year and came back and thought this would be a good place to raise our daughter, who's 5 and would be entering kindergarten this year, so that she'd have the stability of having a school she can regularly attend for kindergarten. In the past 5 years, we have lived in 5 different places, including overseas, and having our daughter attend kindergarten with friends she made from our previous time seemed like a really good family plan. We chose a house that was zoned for Hamilton Elementary that has a great reputation and provide our daughter with the emotional and social stability she needs after moving around so much. But we were unfortunately informed as soon as that we enrolled that we would be involuntarily moved to another school in the North Kingstown school. For reasons that I expressed to many of you up there already, this plan will not work for us, and as you can imagine, my daughter was totally crushed to learn she couldn't attend Hamilton because it was full. And right now, we don't have an elementary school for my daughter to attend because the school that you have involuntarily moved her to will not work for our family plan. I wanted to more significantly say that your North Kingstown policy of outsourcing students to other schools to solve the overcrowding issues at Hamilton is not a viable solution. Outsourcing children to other schools is very damaging emotionally and socially. According to the National Education Association, students' mobility, including outsourcing students, is detrimental to their adolescent development. It disrupts relationships with peers, educators, and has lasting effects throughout high school, including affecting rates of graduation. We chose to go to Hamilton so we would have an opportunity to have a stable environment for our child. I understood from reading Dr. Auger's plan that this overcrowding issue has been going on for quite a while. And I lean on you as administrators to solve and anticipate problems and prepare solutions and resource the schools appropriately so that it doesn't end in new families being forced to move to other school areas where they don't have proper support and ability to move. This has created quite a dilemma for our family, so much so that we literally will have to move out of the area in order to find a new school for my daughter to go to for elementary. As of right now, a week away from elementary school starting, we do not have a viable solution for our daughter to attend elementary school. While I would love to worry about mask mandates, we are looking for a solution for our daughter to go to school somewhere. I think we can do better for new families in North Kingstown, and that means anticipating the increase in children going to elementary schools. And I would request that you consider putting my child in Hamilton Elementary so we don't have to move out of North Kingstown School District. Thank you.
Thank you. Next, we have Keith Mercado.
Keith Mercado Lazarski, 673 Tower Hill Road. All right. I have a script. I probably should stick to it, but I have ADHD, so it's really hard for me to stay in line. I'm I'm a parent. I grew up in town. I'm 45 years old. I went through the system. I stayed here. I love the community. There are certainly much more affordable places to live in the state. But being a teacher over the last year, I'm a phys ed health teacher, and to watch the students go through what they did go through, man, they handle it so much better than the adults did. All right, whether it was online, whether it was in person. Now, with that said, I don't want to teach online. I don't want to teach virtually. 270-pound guy bouncing around in front of the camera, it takes a toll, all right? And the kids found it immensely entertaining, their parents even more so. But when we finally got back into school, man, it was awesome. It was great. Not perfect, still had to wear masks. And anytime somebody was quarantined, people were sad and upset, but was very understanding. You know, my fellow colleagues, they had more of an issue with the masks by far than the kids did. The kids actually had a lot of fun with it. Now, I'm only speaking for elementary level because that's what I work with. And I saw anywhere between like 350, 500 kids a week coming in and out of the gym, making adaptations, teaching in the classroom. But the one thing that we always did is that we worked with data. All right. Now, I'm not a big numbers guy, but when I teach health, I use data to drive my lessons, whether it's results back from the kids on testing or whatever it is. Okay. If it's phys ed, I'm looking at their performance, I adapt and change to it. Information changes all the time. Now, it was great that we had a pediatrician here who was able to tell us more information to help us, right? But the information has been changing from the beginning. I didn't say anything that's on my papers yet. Back when this all started in January 2020, Dr. Fauci basically announced during a media session that, you know, this wasn't going to be a big deal, but the medical community needs to be aware of it. And then it came out that we're not going to need masks, but we should still keep an eye on this. Then in April or May, it came out that asymptomatic people can transmit the disease. He said, well, this information is evolving. We're still in that stage. We're 18 months out. A lot of information has changed, and we have to go by the data. All right? I don't like the masks either. And we're going to be opening it up. If we do a mask policy that is less than what is recommended by all the professionals that do the research and deal with the data, you're going to be opening up the community to litigation if something bad were to happen. Thank you.
Thank you. Next, Tanya Carroll.
Tanya Carroll, 118 Pinecrest Drive. So good evening, Dr. Auger and the school committee members. I appreciate all you, the NKSD staff have done to keep our students safe. Just noting how low COVID rates were in our schools last year. I'm not here to debate the validity or effectiveness of masks. I realize the governor has imposed a ruling, and that's what we're going with right now. So I just have a couple of questions. So in some school districts in the country, they're only mandating masks for K through 6 since vaccines are readily available for ages 12 and up. So what are your thoughts of not mandating a mask for grades 7 through 12 at NKSD given the high vaccination rates that we have here? Second, it's my understanding that virtual schooling will not be an option this year. So what happens when a group of students will have to quarantine for 7 days? That's a lot of school to miss. And then third, I don't have children in the elementary levels, so I can't speak to that. But when will the middle and high school students be notified of what to expect this coming year? Anxiety levels were through the roof last year, and what is being done to address the social emotional health of our middle and high school students? Thank you.
Thank you. Next, I have Tanya Carroll. Oh, sorry, I forgot to check you off. Sorry. Ileana Arsenis.
Good evening, Dr. Auger and school committee members. My name is Ileana Arsenis, and I live at 174 Fieldstone Lane. I'm a 7th grade student from Wickford Middle School. I would like to address a few concerns that I have for the following school year. But before I address my concerns, I would like to share with you how my 6th grade experience was. Entering a brand new school was hard enough, especially with no orientation, and we were required to stay in our seat with our individual pods. We couldn't even socialize within our own pods because the air filter was so loud it sounded like an airplane flying above the school for 8 hours straight. Also, in the late fall and winter months, it was very cold outside. But due to the strict restrictions, though, the teachers were forced to keep the windows open and fans blowing and running all the time. My seat wasn't even near the windows, but I was still freezing the entire time. Think about what the kids at the window seats felt. Often, I would leave my house wearing a hat, coat, gloves, and scarf. I wouldn't even take them off until I returned 8 hours later. Not only were we freezing during the day, but we couldn't even socialize like a normal middle schooler would. During the spring and summer months, the school was extremely hot. Even with the windows open and fans blowing, we all struggled to breathe with our masks on. Multiple times throughout the warmer months, I got extremely lightheaded. And when I took off my mask for a few seconds to actually breathe, I would get threatened by my teachers that if I continued to do this, there would be consequences. In regards to lunch, we were given 15 minutes to eat our food in a darkened room while a movie played that no one had any interest in, to keep all the students quiet and occupied. The desks were 6 feet apart, facing forward, and we couldn't even speak to our neighbor. And if we did, we'd be threatened with the consequences, again. In one instance, the principal threatened to throw one of the players off the basketball team if he opened his mouth one more time during lunch. If I never mentioned that this was a school setting, which other setting do you think these descriptions would fit? Sounds like a prison to me. Please, for the students' sanity, mental, and physical well-being, lift the restrictions so that way we can have a normal middle school experience. Once the governor's mask mandate expires on September 18th, please allow the parents to make a decision for their family whether or not they should mask their own children. Thank you for taking the time to listen to my concerns, and I look forward to 7th grade mask-free.
Thank you. Next, I have Pamela Pinero.
Pam Pinero, 710 Slocum Road. I have 2 children in the school system, one at Hamilton and one who's going to Wickford Middle School. I kind of prepared something and kind of not. I really feel every sort of emotion and feel like I'm on every side of the spectrum when it comes to COVID. I work in a nursing home. I've been dealing with this for a long time. So I have concerns on both ends of the spectrum. I totally understand the indoor mask mandate. I don't have an issue with that. I do have an issue with the mandate for masks at recess. Tonight, my children were playing NK sports. My son was at baseball. My daughter was in gymnastics, not through the town, but she was in gymnastics indoors, and they didn't wear masks. I watched football practice, baseball practice, and cheerleading, and they were all not wearing masks. I can't wrap my head around the masks during recess. My kids have gone all summer without masks, and we've been above in the high transmission for a while. It hasn't changed for them. So I do request that you consider excluding that from our masking policy. I feel like we're not being proactive as a town. I think so many anxieties could be allayed if there was more communication on what the policies are. We get we're wearing masks, but what does the school day going to look like? I don't understand, if you're going back to regular school, how you can socially distance if you're transferring from class to class in the middle school. Is there going to be scattered schedules, bell schedules? I've never had a kid in middle school. How would I know what this is going to look like? What is the ventilation going to be this year? Wickford Middle School has no HVAC system or whatever. So what is that going to look like? I get that we're doing masks, but what else are we doing? And if we're just doing masks, that's where I think a lot of people are confused. How can we just do masks and that's enough? Whereas last year we had to do a whole bunch of other things. What about music? What about chorus? Those have different exchanges of air. Are those going to be allowed this year compared to last year? I've been on other towns' websites. There's frequently asked questions. There's clear COVID guidelines for this year. I request that we get that information out to the parents ASAP. We don't have a lot of time here. Thank you.
Thank you. Next is James Gallo.
James Gallo, 200 Minor Road.
Sure. Thanks.
I'm a first-generation Italian-American. My father immigrated to America in the early 20s. My father was expelled from the school system because of racism. And he went on to complete the 9th grade at the Holy Ghost School. My grandfather died at a young age of 55, working after an 11-hour shift at a mill in Orneyville. Jobs are very hard to come by back then, especially for Italians. Right on the job advertisements, it would say, Italians need not apply. But this didn't stop my father or my uncles. Okay? They were grateful to be in America, and they worked hard. They served in World War II. They started their own businesses. They raised respectable families. One of my father's sons became a Superior Court judge, and one became a doctor. And I'm the doctor. I'm a board-certified psychiatrist, over 30 years of experience. My secretary, African-American, 16 years with me. She has 4 children, 4 different fathers. She's from the hood. She introduces me to her cousins and friends, and she says, he's from the hood. Her children refer to me as grandpa, excuse me. I look at that as a term of endearment, but I don't really appreciate the grandpa part. My point is, I grew up in Providence and I attended the public schools till the 8th grade. The race riots of the 70s put an end to that. And my father feared for his family and he moved us out to Coventry. Busing was the issue then. Busing failed miserably, a national initiative experiment that accomplished nothing but creating racial tension and division. Families with means sent their children to private schools, and the families, or they moved to the suburbs. The students had nothing to do with it. We weren't racist. Heck, one of my best friends was African American, and I put a picture up there for you all to look at. That's me in the 7th grade, Bridgham Junior High School. That was my last year I was able to spend in Providence. It was a great school system back then. I also lived in Mexico 4 years. I was a minority in Mexico. I was referred to as gringo. But I accomplished what I needed to accomplish. I received my medical degree. And my parents came down to see me cross the stage and receive my diploma. They were proud. And it brings tears to my eyes because I know it brought tears to theirs. So my complaint to the school committee is about DEI subcommittee. I'd like to know why I wasn't chosen.
I'd have to ask you to wrap up, please.
I'd like to know why I wasn't chosen. I applied. Just so happens that I'm a registered Republican, and all the selected are Democrats and one independent. And I heard Ms. Lima had most of the selection under her supervision. So I'd like to know, why wasn't I selected? Did you choose people who all think the same?
Again, if you could please wrap up,
why am I
sir.
not considered? Did you discriminate against my skin color, my sexual orientation, my voter affiliation? Where's the diversity, equity, and inclusiveness? The DEI committee is a farce and pointless. Your next APRA request is going
if you could wrap up, sir, please.
To explain why myself and 43 applicants were not selected, and I hope you can defend those criteria. I guess you don't want to hear what our thoughts are. And I attended the meeting.
Sir, your time is up.
One of the meetings...
Sir, your time
started
is up.
out with color blindness.
Sir,
okay?
Your time is up, please.
I'm not done.
Sir, everyone gets the same amount of time. Doesn't matter what you're saying, you get the same amount of time as everyone else.
So I guess I'm colorblind because I always refer to myself, I always looked at it as you don't
make a motion
judge
for a
yourself-
recess.
You don't judge yourself for people by the color of their skin.
Do I have
by
a second?
The content of their character.
Second,
I
all
always
those in
thought-
favor?
So am I racist?
Aye.
What is it?
Any opposed?
Something that
We are in
started
recess. Thank you, sir.
Something that started out as good is now
Sir, if you
bad.
continue to
It's
disrupt the
creating
meeting, we're not
divisiveness.
going to be able to continue.
This is the start of CRT, and I know it, and the agenda is trying to be slipped under our noses in disguise. Where's the transparency? The parents have a right to complete transparency, and they're not getting it. They're angry, and rightfully so. Now, we can debate CRT. This is the start of CIT. There's no question about it. Whether it's wrong or not, I'm not going to debate it. But students from K1 to 12 need to learn how to learn, not how to think. They need sports, math clubs, English, poetry clubs, science clubs, theater. Let's teach children what they need to know so they can tap into the opportunity.
All set? Okay. Folks, we're going to call the meeting back to order. So just as a reminder, and I apologize, I don't care what you have to say, whether you're for, against, up, down, left, or right. We ask that everyone please limit your comments to 3 minutes so that everyone has an opportunity to speak and that we can conduct our business. That's all I ask. So I'm going to treat everyone the same. Next person is Timothy McLeod, I believe. Tiffany, I'm sorry. It does say Tiffany, that's me, sorry.
Hi, my name is Tiffany McLeod. I live at 21 Shelley Lane.
Can you pull it up a little? We can't quite.
Oh, sorry.
No, not the mask. I meant the mic. That too, but.
Can you hear me now?
Can you tap it? Okay, yeah, no, it's working.
Okay. My name is Tiffany McLeod. I live on 21 Shelley Lane. Mr. Blazer, you're the man. I just wanted to say that really quick. He was my teacher when I attended North Kingstown High School. I never in my wildest dreams thought that one day I would be back in this auditorium fighting for me and my child's constitutional rights. I've listened to your arguments, and they're missing a few things, mainly common sense and basic human decency. You've presented no facts at all, so let me do that for you. COVID-19 poses almost no risk to our kids at all. 4 million and counting children have tested positive for COVID. 0.008 of them have died. That's roughly 300 children.
480 children have died during the 2018-2019 flu season. Did any one of you on this board suggest that kids wear masks at any point during that year? Did anyone in this auditorium, anyone in this town suggest that we mask our children for that year? No, we did not. Now let's talk about the masks. On every box, it clearly states they do not protect against viral transmission. They are at best a fashion statement and a poor one at that. The actual apparatus to prevent viral transmission is a hazmat suit, not a disposable or cloth face mask. Asking our children to wear a face mask to make someone else feel safe, knowing full well it's ineffective, is not only wrong and unconstitutional, it's mental. I'm looking around the room and I'm seeing lots of different kinds of masks. Some are homemade, some are disposable. Little do most know those materials made to make these disposable masks have been proven to be carcinogenic. I feel more comfortable letting my child go maskless, which is my parental right, than exposing him to something that could possibly cause him to develop cancer, all to make you feel better. Did you know what it's called when you force children to wear masks for a fear of a virus that poses almost no threat to them? Anybody? Child abuse. Thank you. It's called child abuse. It's utterly insane charade, and I'm quite frankly tired of it. Do any of you know what sort of psychological damage is being done to our children by forcing them to cover their faces, teaching them that the air is toxic and everyone around them is sick? What about learning how to read and you can't see the teacher enunciate the words? This is not to keep our kids safe. They are safe. The data proves that. It's not to keep the adults safe because they can all get vaccinated. You do it to make yourselves feel better and to protect yourselves politically. It's a disgrace and you should all be ashamed of yourselves. Thank you.
Thank you. Next is Savina Arsenis.
Hello, Dr. Auger and school committee members. My name is Savina Arsenis, and I live at 174 Fieldstone Lane. Saying that this past year has been difficult is an understatement. What I and my peers have endured from the start of this pandemic to today is like something out of a science fiction or dystopian novel that just doesn't seem to end. From masking to a completely messed up school schedule, we have gone through much more than you could possibly imagine. Here's my story with COVID. I am an extremely positive and confident person who is always happy-go-lucky about everything. Or I was like that until March of 2020. I have since returned to my normal self, but here's what happened during the first lockdown. Everyone my age, including myself, was excited to get an extra week of spring break, until it turned into months on end. I have never had any issues with mental health, but during that time, I developed extreme stress, anxiety, an eating disorder, and depression. The first lockdown and the following months of dealing with COVID took an extreme toll on my body, mentally, physically, emotionally, and socially. This may sound like an extreme flip of the switch, but it's what happened to me and many of my peers. It took a lot of work to get back to my normal self, and I never want anyone to go through what I went through. Moving forward into this past school year, masks in school and during sports made it extremely difficult to make friends and connect with other people. Going back to school, everyone was so messed up from lockdown that we literally forgot how to interact with other humans. Lunch, which would have been used as a way to get to know your peers, wasn't even in the question anymore, and schools that did have lunch were forced to silently eat 6 feet apart, facing forwards in the dark watching a movie. While being in school with masks was difficult enough, masks during sports was by far one of the worst experiences of my life. I play field hockey and lacrosse. Both sports require a lot of cardiovascular endurance, and we all watched as that critical component of our sport dwindled in each and every one of us because of the masks. Hybrid learning, it was definitely a struggle. Think about how unpleasant it would be sitting at home on your virtual days, stuck at a computer all day, with a 4-minute break in between 1.5-hour classes. Teachers seemed like they didn't even enjoy what they did anymore because the conditions were so miserable, trying to attend to both in-person and virtual students. It was very difficult for them. I refused to go back to the hybrid program or 100% virtual. May and June were the 2 best months of the year, hands down, and I finally got to meet new people from the other day, and there weren't any mask mandates for outdoor sports. At the beginning of the pandemic, my family and I were extremely understanding of the decisions made by officials to protect us from this virus that we had no idea about. And we didn't know how it would affect our lives, so we were desperate to return to a sense of normalcy. Now, 17 months into this pandemic, and there are still too many restrictions. I vividly remember one instance during the past school year that I pulled my mask down to speak to another student so that she could hear me a little bit better, and the class went silent and just stared as the teacher yelled at me in front of everyone. In conclusion, I firmly believe that it should be a family choice on masking going into the upcoming school year, not a statewide mandate. Thank you for your time.
Thank you. Next, I have Jake Mather.
I'm reading this on behalf of Rebecca Laptuk of 193 Laurel Ridge Lane in North Kingstown.
And if you could state your name and address too.
My
Sorry.
name is Jake Mather, 135 West Allenton Road in North Kingstown.
Thank you.
I'm unable to attend tonight's school board meeting and would like to ask if you could please read my email below aloud so that it can be included on record during the public comment portion of the meeting. I had hoped to deliver my message myself. However, as there's no longer a virtual participation option for these meetings, I'm not comfortable attending in person due to the potential for the large gatherings and likely with many not wearing masks, thus increasing my risk of exposure. Dear North Kingstown School Board members, I'm writing to you as a North Kingstown resident, parent of a 3-year-old, aunt of 4 kids at Stony Lane and 1 at DMS, a child psychologist at Hasbro Children's Hospital. I'm writing to urge you to implement and maintain a mask mandate for North Kingstown schools. I'm not sure if child care centers in North Kingstown will follow suit, and believe me that I feel very conflicted about my 3-year-old wearing a mask the whole day. But if it's a matter of health and safety of my son and other kids, there should be no question. I recently spoke to my relatives in Dallas, Texas, who informed me that there is 0 pediatric ICU beds in Dallas. This should be terrifying for any parent to hear, as it's a similar story in other places. I know it's not currently the situation in Rhode Island, but it's not hard to imagine that we could head in that direction. I work at the Hasbro Children's Partial Hospital program, where children have been wearing masks the entire year, even the ones whose parents say they have too much anxiety to wear a mask. We support them in doing it, and this is non-negotiable because it's a public health issue for them. The other kids that they're around and the staff who work with them, non-negotiable because it's a public health issue for them, the other kids they're around, and the staff who work with them. This past week, all Lifespan employees were informed that we had to again start wearing eye protection when in contact with patients, and all emergency department staff have to now wear N95 masks. No one likes this. We're also relieved when restrictions started to be lifted, but the reality is that the number of cases are rising. The Delta variant is more contagious and it affects children more. As such, our responsibility is to take actions to ensure the safety of everyone. If children are expected to go to school in person this year, all children and staff must be protected as much as possible. The easiest way to do this is by mandating masks. It shouldn't be a question. It shouldn't have become as big a deal as it has. Where was the uproar around the law that you have to wear a seatbelt? Sure, it may be more comfortable not to wear one, and your child may not like to have it on, but you do it because it's the safest thing to do. I also serve on the National Board of Selective Mutism Association, where treating professionals have discussed requests from families around writing doctor's notes for their child to be exempt from wearing a mask at school. The consensus has been that while there may be some sound reasons why this could be helpful for a particular child, the current public health crisis and the risk of Delta variant posed to all children who cannot get vaccinated supersedes everything right now. A memo recently went out to all members and government school officials.
I have to ask you to please wrap up.
Rhode Island chapter of American Academy of Pediatrics on the issue of masking in school. There's no refuting the science behind this. We do what's right for all children and keep them safe in school by instituting a mask policy. Thank you.
Thank you. Next is Chris Stewart.
Hello, Christine Stewart, 78 Eileen Drive. I have a son at Davisville, and he went to school all last year, and he didn't have any of these bad experiences, so I don't know if it's a Davisville issue, but it was good. Also, I wanted to just be here to say I support the mask mandate. I do have a question about the playground. I agree that we know that respiratory disease spreads through poor circulation and air, so if you're outside, I don't see why the kids need it, but that's that. The other thing I wanted to say is that I'm an audiologist, and speaking for the kids with hearing impairment, It would be great if the teachers did have a clear mask on. So there are kinds that either just come across your nose and your chin and they're clear and don't fog up, or I have one that comes across my forehead down around my face and it doesn't fog up. They really need to be able to see your face, never mind all of the other benefits of seeing people's faces. So please consider at least getting clear masks for teachers of the hearing impaired.
Thank you. Next is Nicole Villani.
Hello, my name is Nicole Villani. My address is 7930 Post Road, North Kingstown. I was here 2 weeks ago expressing same concerns for masking. I'm here tonight to express my strong hesitation to send my 5- and 6-year-old boys to Fishing Cove Elementary School this year based off of the governor's decision to strip me of my parental choice for masking. I have several key points that I would like you to take into consideration for future revisions for this mandate throughout the school year. 1, the effectiveness of masks is not conclusive. A July review by the Oxford Center for Evidence-Based Medicine found that there is no evidence for effectiveness of face masks against the virus infection or transmission as it is transmitted through aerosol particles. 2, masks can often cause headaches and fatigue. On June 30th, 2021, the journal JAMA Pediatrics published a study which looked at the impact of masks on children. The study was led by a researcher in Poland who was joined by 6 other doctors from Germany and Austria. The researchers concluded that there was a significant buildup of carbon monoxide in children using masks to levels that are well beyond what is considered healthy for indoor air. My son came home from school complaining of a headache and stomachache most days, only during the months that he returned to in-person learning. He is a happy and healthy child otherwise. 3, reports show dangers associated with masking. Our mouth airway is one of the few but extremely important ways for our body to expel bacteria and toxins. We are constantly recycling bacteria by wearing a mask and in turn weakening our immune systems. The CDC's statistics show people who wear masks get sick at a significantly higher rate. In July 2021, the CDC report titled Community and Close Contact Exposures Associated with COVID-19 Among Symptomatic Adults 18 years and older in 11 outpatient healthcare facilities conclusively showed the vast majority of COVID positives were in people who frequently wore face masks. And 4, masks can hinder speech development in children. When my youngest son struggles with pronunciation, he looks to an adult for verbal cues to correct his speech. By hiding teachers' lips and muffling their speech, mask wearing makes it harder for young children to develop linguistic skills and prevents children with hearing impairments and speech impediments from lip reading. Unable to rely on facial cues, teachers and students of all ages are more likely to misinterpret one another, and particularly acute problem for children on the autism spectrum. How are children supposed to develop social skills when they can't see one another's faces, sit together, or play together? Let's not forget to mention the undue anxiety that we're causing these children and the numerous effects that we may see in the future from extended mask wearing. Nelson Mandela famously said, "There can be no keener revelation of a society's soul than the way in which it treats its children." By that standard, our society now has the soul of an abusive parent. For our children, it is all pain and no gain. For those of you
I have to ask if you could please wrap up.
For those of you that are making the mandates and revisions, I please ask of you to consider how your rules impact our children on a social, emotional, and physical level. You have no right to decide how my children will respond to the impacts of your mask. It is up to me as their mother to evaluate the overall safety on the mask use of them and how it will impact them individually. These are my children, not yours. I know them best.
Thank you. Next is Anthony. It's either Silva or Silver or something close. Sorry.
Good evening. My name is Anthony Silva. My son's address is 11 Mark Drive. I have sent the school committee and the superintendent with emails with multiple studies, article, white papers, videos showing that most masks are ineffective. Prolonged masks can have serious negative health effects on both physical and mental health, that masks can cause more harm than good, that children have little chances of getting COVID, that asymptomatic spread is less than 1%, dangerous pathogens are found on masks worn by children, some treatment doctors are using with success, preventive measures to limit the risk, and more. The Gloucester School Committee is considering legal action against the State Council on elementary and secondary education regarding the vote last week to block Department of Education from accepting any school reopening plans that do not require a mask mandate. I believe North Kingston School Committee should look into legal action as well as possible joining this lawsuit. Governor issues an executive order on mandate for the school. As we learned throughout this pandemic, many of these orders were found unconstitutional and overturned throughout the country through court cases. Do what's right and stand up for a child's right to breathe fresh air, even if that means working with other school committees and bringing legal action against state and or the governor. Masks should be a parent's choice and a student's choice, period. Thank you.
Thank you. Next, I have Kim Lanoy.
Hi there, Kim Lanoy, 47 Sylvan Court. I kind of gave my remarks while we were on recess, but so everybody else heard them. I won't repeat all of it. Suffice to say that the school last year failed to collect any amount of reasonable data to support what you're doing. The numbers in all of the schools were very low. I mean, in one of the elementary schools, they only had 5 cases during the entire school year. And I know somebody laughed and said, well, that means masks work. No, it doesn't. If you don't have a school that didn't have masks to compare it to, you have no idea. But guess what? Lots of schools in other states had choices. Some schools had masks, some schools didn't have masks. And you know what the data showed? There was no measurable difference in the number of cases. There just wasn't. And so everybody else has given a lot of great data. I sent you guys, all several APRAs asking about data. And what I got back was I asked how many tests were run. The district did not record that data. How many positive tests were run? The district did not record that data. How many students were quarantined? The district did not record that data. How many quarantined students ever tested positive? The district did not record that data. The district didn't record any data. I don't know why. It's insane. I also asked for the name of the pediatrician, which I got was Dr. Silversmith. I asked for a copy of the medical study used by the school department to justify the safety of masking our children for up to 6 hours a day. Guess what? They don't have a study. None. The district followed RIDO guidance. Okay, so you're not following any actual data. Everybody here has given you a lot of data. So we'd like to ask you to follow the data. Dr. Silversmith even spoke about the fact that really the only decent masks are N95 masks. CDC has said that. The NIH has said that. Hey, here's an idea. Either give everybody an N95 or 2 or 3 for the day, because they do get kind of sweaty, or no mask. They're not doing anything. It's crazy. To the people that think teachers should wear plastic masks, no thanks. I agree that kids should see our faces, but I can't teach in a plastic mask all day. This is torture. Yeah, no thanks.
Okay, just one person, please. I'm sorry.
Yeah, I think, and then the last sort of just egregious thing that you all did recently was that you sent a survey out, and you said that the purpose of the survey was to ask for the community's input on masks, but you never asked parents whether or not they wanted their kids in masks. You literally, I mean, talk about not wanting the answer. You literally just asked us.
I have to ask you to wrap up, please.
For our name and address, and you asked us what we thought you did well and what we thought you didn't do well. You didn't do anything well.
Thank you. Okay, that's the last person I have on my list. Is there anyone else who wanted to speak? Thank you. No one there? Okay. Do you want to speak too? Yep. If you could just write your name and address on that paper when you're done is probably easier. So.
Excuse me. Thank you. My name's Lisa Hunter, 88 Woodhaven Road, North Kingstown. I'd like to lead with gratitude for everyone's voice and opinions here tonight. A gentleman spoke earlier, and he would like this read into the record. Do you need his name or?
Is it someone who spoke already?
Yes.
You can't speak twice. You get one time.
Well,
so you're welcome to speak on your own.
I'm going to read some of his thoughts that I'm considering.
So you say what you want to say for you. Yep.
Okay. So he's concerned, and a lot of other parents are, about the DEI subcommittee. He feels, there's concern that it's a fraud. There's problems with waste of resources, and that this was originally a national initiative. Just look at the Providence schools. They are a disaster. The decline started after a national initiative in the 70s. Remember the busing? That was a failure, with a rise in racial tension, division, riots. DEI, look locally. Our town is unique, like every student, parent, and teacher. This is not Chicago. We are not LA or Harlem. The parents should be driving the bus, not the federal government. North Kingstown schools are not racist. Racism would be dead today if it were not for certain people and institutions keeping it alive, including the public education. I can understand some situations. Nothing is more damaging to our society than to tell a child born today that they have grievances against another child simply because of their ancestors and what they did over 2 centuries ago. Teaching children that they are victims is harmful and does nothing but cause divisiveness. Stop fanning the flames of what little embers are left. Let racism die the death it deserves. Thomas Sowell said, "Ours may become the first civilization destroyed by the power of our enemies, but by the ignorance of our teachers and the dangerous nonsense that they are teaching our children." And lastly, this is not Black America, not a white America, and not a Latino America. They're only the United States of America. Barack Obama. Thank you.
Thank you. Okay. Anyone else wanted to speak who isn't on a list?
How are you guys? I'll be brief. Kyle Rowley. My kids are at 7930 Post Road, North Kingstown.
I need your name and address, sir.
Kyle Rowley, 7930 Post Road, North Kingstown. I just want to point out some hypocrisy. I know that there's a mandate by the governor now. So, I don't know what the pushback necessarily means if we're asking you guys to bark uphill. But I was here 2 weeks ago, and every single person on the school board sitting in front of me had no mask on in one of the schools that we're trying to decide whether we're going to force kids to wear masks on for every single hour of the day. And these meetings only last an hour and a half, 2 hours. I just don't know how you guys can sit here and feel okay about that. So that's my first point. Secondly, I'm going to go where no one else is going in this meeting. Everyone seems to be way behind on the news. We don't even have an isolate for COVID-19. Multiple countries have admitted this and have stripped all protocol. So we need to look into COVID-19 as an isolate. Furthermore, you need to look into remdesivir as a protocol that Dr. Fauci demanded that the entire United States use as protocol in our hospitals, which is proven to kill United States citizens. We used it the most, we had the most deaths. So everyone please Google that. Don't use Google, use DuckDuckGo because that's compromised. But let me just end with, how the heck are we not even starting the meeting because a couple people don't have masks on at a meeting about masks when none of you had a mask on 2 weeks ago?
Thank you. So next we have Superintendent's report. I'm just going to answer that question. There wasn't a mask mandate 2 weeks ago. It's as simple as that. Dr. O'Shea.
Thank you. So.
Oh, wait, I'm sorry. There's more people. I didn't see them. Sorry. My apologies. Nope, you're still good.
Hi, Erin Earl, 170 Matola Drive. I am a parent of 2 elementary school-aged children, one that is entering the 1st grade and one that is going to start pre-K this fall at Forest Park in Fishing Cove. First, I just wanted to say thank you so much to the superintendent, the school committee, for doing a very difficult job during a very difficult time. As a mother of a student going into kindergarten last year, we made the difficult decision to keep our son home for virtual kindergarten, which was immensely challenging, both for him and for us. But we are very grateful for the opportunity to be able to have him home safe as things were uncovering. We are very excited that he is going to be attending Forest Park this year as a 1st grader, and as I mentioned, our daughter will be going to Fishing Cove as a pre-K student. I just wanted to state that I am in support of the masks in school, as I feel in this time of ever-changing information and an ever-changing virus, it is important and essential that we do anything we can to try to keep our students safe. And I completely understand that the information is changing often, that 2 weeks ago things were differently than they are right now, that we don't know everything about this virus, but what we do know and what we are seeing from different school districts around this country is that we need to do anything possible to keep our students safe and also keep them in schools. Virtual learning is an alternative, but we know that them being face-to-face, even if that's with masks on, is better than the virtual education. And I feel that it is our responsibility as North Kingstown citizens to do everything we can to protect our students, our teachers, our staff, and our community. And so I, again, am in support of doing anything we can to keep our students safe, even if it's something that might make us uncomfortable or maybe the students uncomfortable as well. Thank you.
Thank you. Yep, next.
All right. First, I just want to say thank you to everybody here for coming and voicing your opinions. Whether we agree or disagree, it's important that we're all here. Thank you to the administrators for all of your work this past year. Like, no one knows how hard that was to keep everyone happy and safe and healthy and learning at the same time. And Mary Cooney, Mary Cooney, 12 Bayview Avenue. I have 2 students at Forest Park. I'm also a teacher in the district, but I'm in support of mask wearing to keep the kids safe. I know my kids don't love them, but for the safety of others, we're willing to have them wear them. So thank you.
Thank you. And next.
Good evening, Jim McGuinn, 412 Chimney Rock. A couple points. At the last meeting, there was a student who got up and said that she played band and she played the saxophone. And to play the saxophone, she had to wear a mask with a hole in it. Now, I do expect that you teach science. This is a respiratory illness with airborne particles. And someone who's playing an instrument is breathing at a higher velocity than they would be talking. So that doesn't make sense. If you're going to put N95 masks on the end of a saxophone, Maybe. I ran a medical device company where we made implantable medical devices. We had to have clean rooms, HIPAA. I understand what N95 masks are and how they have to be fitted. That's something you might want to look at. And being outside with masks, you're probably going to go with the mask mandate, but use some common sense and don't teach the kids poor science. Secondly, I'm on the asset management. There's issues with Wickford Middle and ventilation. It does not have a HVAC system. You've gotten, I think, $6 million from the federal government. Why don't you put some of that money into putting HVAC in that building? There are split units. Maybe you are. And if you are, I'm very glad. But that hasn't gone by asset management. And you know for years, I have lobbied.
One person speaks, please.
I have lobbied that the school department get money to maintain these buildings. So this is not new. And HVAC is an important one. And I know how much you've spent on this building. But please do something with Wickford Middle. Those kids can't be open, windows open during the year. It's just not healthy. And I can't believe what the heating costs are. So use some of that money wisely. Thank you.
Thank you. Anyone else wanted to speak?
Brenda Glover, 5 Champlain Road. I am also a teacher in town. I do not like masks, but I'll tell you what I didn't like more last year. Was agreeing to put my mother on a ventilator, and then 5 days later, having to tell the doctors to take her off. I wasn't a contact. She wasn't a contact. It was in November. Contact tracing was happening. Neither one of us were identified. I ended up positive. She was positive. Did I bring it home to her? I don't know. I'll live with that question the rest of my life. Wear your masks. What I had to do, I don't wish on anyone. And I'm sorry for the little ones. I teach first grade. It's tricky. It's hard with the mask. But the other options are even worse. Thank you.
Thank you. Anyone else? Okay. So Dr. O'Shea, Superintendent's report.
Yes, thank you. I don't have too much. I already said plenty, but I just want to point out that once this meeting is done, there'll be a much more communication about these protocols that we plan on executing, things like FAQs, that sort of thing. More of that will be going out to the community. So that's all I have. Thank you.
Okay, thank you. So going along the agenda, we have routine items. I'd ask for a motion to seal the executive session minutes of this evening, August 24th, 2021. I can't hear it. Sorry, if you could just say it. Okay, and could you put your mics on because I can't hear, and they can't hear you. There we go. Okay, and I have a second. Okay, so I have a motion and a second. So that's a motion by Ms. Lima, second by Mr. Mather. Any discussion? All those in favor? Aye. Any opposed? Passes unanimously. And I can disclose that no votes were taken in this evening's executive session. Anyone like to exempt anything from the consent agenda? And hearing none, I ask for a motion to approve the consent agenda.
So moved.
I have a motion from Ms. Hildebrand. Do I have a second? Second from Ms. Lima. All those in favor? Aye. Any opposed? Passes unanimously. Okay. 2021 school budget, Mrs. King?
Nothing.
And 2021-22 school budget?
Nothing.
CIP existing bond, future bond?
At the August 10th, 2021 meeting, it was fully discussed to move forward using federal funding to put in a ventilation system at the Wickford Middle School. That's all I have.
Okay, thank you. And so we have reached policies, which is why most of you are here. So for discussion purposes, I need a motion to approve policy D1.
So moved.
I have a motion from Ms. Hildebrand. Do I have a second? I have a second from Ms. Lima. Okay. So this is the policy proposed by the superintendent. I'm just going to make a couple comments. They were made in Dr. Auger's presentation, but it's nothing against your presentation. It's just I've gotten so many questions about this that people don't understand part of it. So the governor's mask mandate supersedes anything that we do. If we were to do nothing right now, there would be masks on the first day of school. It's as simple as that. This policy, if it is more restrictive than or covers an area that's not specified in the governor's order, would control. And also in the event that the governor's executive order were revoked, overturned, anything like that was no longer in effect, our policy would control unless we changed it again. I fully personally expect that we'll very well may be revisiting this policy. Things have changed in the past month so quickly. If you had asked me 6 weeks ago, would we be even talking about wearing masks in school, I would have told you no. And there are people that I did say no to. But over that time, things have changed. The CDC has changed, the Department of Health has changed, the Department of Education has changed all of their guidance. Everything that, and these are my part, I'm going to start, sorry. Everything that we have done last year, whether it is some of the restrictions that people thought were awful, which I thought were awful, whether it was some of the rules about distancing, the inconveniences that had, the effects that had, because kids had to be farther apart, it meant we couldn't do certain things. Those were all because of guidelines that were given to us by medical professionals at either the Department of Health, Department of Education, with information given from the CDC or other professionals. I hear what you folks have said, the studies that you provide, all of that information. I take a look at it. I do. But I am not a medical doctor. I am not an epidemiologist. There's no one at this table who is qualified to read a medical study like that and make a decision on what we should or should not do. And as a result, for me, what we need to do is rely upon what the people who are epidemiologists, who are medical doctors, who are professionals in these fields, and they have told us what to do. And I have said to anyone who has, and I say again, to anyone who has a study, an example or a reason that you feel that masks are inappropriate, that they are dangerous, that they are all of the things that I have heard you say, please, by all means, send those studies to the people who are making these decisions. And if they look at them and they agree with you, their guidance may change, and we will change our guidance accordingly. But right now, we're dealing with what we're being told is the right thing to do. And that is why I support the policy that we have in front of us. Anyone else like to chime in?
Yes.
Mr. Mather.
To chime in. I'm going to echo quite a bit of what Greg had just said. And I do fully understand that these guidelines are quickly changing, and this policy that Dr. Auger is proposing reflects a moment in time. That doesn't necessarily mean it's this moment in time. And I think that's where I have a problem with it. North Kingstown, currently, we have 3,914 students in our school system, roughly. 1,895 of those students are in grades 1 through 6 and are therefore ineligible for vaccine. And if we assume that each and every student in grades 7 through 12 over the age of 12 has received their vaccination, which we know is far from the truth, but that's the only math that I have right now because we don't know how many students are vaccinated, that leaves 48% of our student population ineligible and therefore unvaccinated. And how, I'm asking, is it equitable that we implement a masking policy that does not meet current recommendations for over 48%, well over 48% of our student population? It actually puts them at risk. What right do we have as elected officials? None, and as Greg said, none of whom studied infectious diseases or immunology, to implement a masking policy that doesn't meet the recommendations from the Center for Disease Control, the National Center for Immunization and Respiratory Diseases, the Rhode Island Department of Health, the American Academy of Pediatrics, the Rhode Island Department of Education, and an overwhelming number of health professionals. Guidance from the CDC, the DOH, the AAP, the NCIRD, and RIDE specifically recommends that all unvaccinated people should be wearing a mask while indoors in public. The language in these recommendations also states that during periods of high and medium transmission, all people should be wearing masks, not just those that are vaccinated. But furthermore, and probably more importantly, their guidance clearly recommends universal indoor masking for, and these are direct quotes, universal indoor masking for all teachers, staff, students, and visitors to K through 12 schools, regardless of vaccination status. If our governor does not renew the masking mandate on or before September 18th, when the current mandate expires, we need to have a masking policy in place that carries these recommendations forward until our guidance changes. Last year, we, as a school committee, made a financial and conscientious commitment to our students and families, which gave those that needed it the option to learn from home, including myself and my family, all year. This year, however, that's not an option, but it still should be our job again to renew our commitment to our students, teachers, and staff to keep them as safe as possible. I think the only responsible thing we can do is, in this policy, is to eliminate the language in our mask policy that does not support universal and mandatory mask wearing in our K through 12 schools. I'm recommending that we amend this policy to eliminate sections 4 and 5 that refer to low periods of transmission, moderate, substantial, and high. And this is not consistent with the current guidance we're receiving. We might also consider removing the second paragraph of section 7, which gives the superintendent the authority to amend the policy. The bottom line for me is that this guidance and direction should be coming from our trusted health agencies and professionals and not school committee members, administrators, or well-meaning members of our community. We have students in the career and technical education program here at North Kingstown High School traveling from Cheraho, Coventry, Cranston, East Greenwich, Exeter, Jamestown, Narragansett, Pawtucket, South Kingstown, Warwick, Westerly, and West Greenwich, as well as teachers and staff in each of our buildings, traveling from many more towns around the state. We are not as isolated as we think, and if we base our decisions on local data, that would be a mistake. That's all I have to say.
Thank you. Thank you. Anyone else like to speak? Ms. Lima?
I want to thank all the parents who sent us emails, who spoke here at meetings regarding masking. It's always important that we hear how people feel about things that affect them, and everybody knows clearly tonight was a perfect example that there's very strong views on both sides of this issue. As a school committee member, my personal views on this issue don't matter. As both Greg and Jake have alluded to, we're tasked with operating in the best interest of all students within this district. And from that standpoint, the guidance is clear. All health, CDC, AAP, RIDE and RIDO all recommend indoor masking for all students regardless of vaccination status. It's not our job to substitute our judgment for those of the medical professionals. The administration crafted this policy with the safety of everybody in the district in mind. I do think that there are some areas, especially I would like to see as we review it, the outdoor recess being one of them. I would like to see that tweaked. But tonight I think it's important that we have a policy in place in the event that the governor's mandate disappears. So I support this policy with the eye to eyeing it to revise it, and I think it's important that we recognize that it's not. We need to rely on the judgment of the medical professionals in this area and look to them for judgment. So that's all I wanted to say. Thank you.
Anyone else?
I would like to speak.
I
support what Jen just said.
You pull that a little closer, it would.
Yes. I do support what Jen said about that we do need to have a policy in place, that the policy that was presented to us tonight has the backing of Dr. Silversmith and others. So that being said, we are going above and beyond with the outside recess since the governor has not mandated it outside. And Greg, you said that means the policy that is written that way would supersede the governor. So I don't know at this point if we talk about the outside policy part of it.
Well, I mean, the answer is we can change anything that we want in this policy if someone wants to make a motion to make an amendment to it. But you're correct. So if we had a policy that said no masks, it wouldn't matter on the first day of school. The governor trumps. The governor's order is silent. It only talks about indoor. Okay, so if we adopt a policy that says that masks are required at recess, which is what is in front of us, then that would be in effect because the governor's order wouldn't override that. It doesn't speak to outdoor. So if someone wants to make a change to the policy, we can do that tonight.
I would like to make a change to the outdoor
Okay, so
policy.
what you'd want to do is, and this is where I do my Robert's Rules thing, but you'd want to make a motion to amend and say you want to make a motion to amend and say what you want to change.
I would like to make a motion to amend the policy with regards to outdoors.
And what you have to say what you want to do.
Meaning there's no masks at outdoor recess.
I'll rephrase it for you and you tell me if it's what you want.
Or it's parent choice at that point.
Well, it's always parent choice with respect to wearing a mask even if we don't require one. So just I want to make a point. So if we were at a point where masks are no longer required, no one is going to be telling a kid that they have to take their mask off. I just want to make that clear. But so what I think you're saying is you want to make a motion to remove, do you have that?
Yeah,
Bring it
I
out,
think it's this part right here, right?
Let me just find it in the policy. Oh, that's the recommendation. It's... Section 5. Thanks, Dr. O'Shea.
Oh,
Yep, so it's...
students and staff are required.
It would be the first paragraph of Section 5, which currently reads, during periods of substantial or high transmission in North Kingstown, all individuals are required to wear a face mask/face covering when entering a district facility or attending school. And then it says, students and staff are required to wear a mask during recess, crowded outdoor settings, or during activities that involve sustained close contact with other people who are not fully vaccinated. So with your motion to amend, I'll give you that. I need to know what it is you'd want to change.
The recess. Yes.
So you just
during recess.
Okay, so let's rephrase it to say, I mean, I don't want to put words in your mouth, but you just want to remove the word recess?
Yeah, just during recess. The rest of it are just recess. Well, we're not doing.
Well, just
recess.
Okay, so why don't you restate your motion? Or I'll help you. I think you want to make a motion to amend the policy to remove the word recess from paragraph
5.
Let me see for a second. Yeah. From the last sentence of the first paragraph of paragraph 5.
Right.
Okay. So we have a motion on the table. Do we have a second? We have a second from Ms. Lima. Any discussion?
So just to be clear, I don't have it in front of me. It will say students and staff are required to wear a mask during crowded outdoor settings or during activities that involve sustained close contact with other people.
If the amendment passes, that's what it would say.
Okay.
So, I'm a little concerned about that. I mean, the reality is recess, first of all, recess only happens in elementary school. So we are already talking about the children who are not vaccinated. We're not talking about middle school. We're not talking about high school. Because if you remember, it's between, like 7th grade, I think, when children would be first eligible at this time to get vaccinated. So the elementary is the completely unvaccinated population. And recess is not, remember recess. Recess is not social distancing. Recess is everybody's over everybody. I mean, so that's what I think the logic behind it was when Dr. Ajay made the proposal. So I'm a little concerned about that. Other discussion?
I can speak.
Dr. Ajay, we'll start this way and then we'll go to you.
So on the first page of the proposal, I took that language, as you can see. I quoted the Rhode Island Department of Health and RIDE on their August 3rd document saying for outdoors. It's on the bottom of the first page 32 of your packet. Outdoors in general, people do not need to wear masks when outdoors. However, particularly in areas of substantial to high transmission, CDC recommends that people who are not fully vaccinated wear a mask in crowded outdoor settings or during activities that involve sustained close contact with other people who are not fully vaccinated. I'm just not sure how that is not recess. I'm thinking a lot of kids huddling together, playing on the monkey bars together, that kind of thing. I realize the air is better outside than inside, but this is, I pulled the language right from that. So trying to follow the Rhode Island Department of Health recommendations here.
Other discussion?
In my mind,
Can you pull it? Yeah, it's hard to, I know they can't hear you if you don't.
I understand, and I can see where Dr. Ajay is coming from, and I do understand that. I guess when I read crowded outdoor settings, I think of concerts, I think of crowds being pushed in. Like, it's been a long time since I've been at recess or had a kid who's at recess, but I don't know, how much of it is really like this for an extended period of time when you are at recess. And how long is recess?
20 minutes to half an hour, generally.
So, and the entire class is not going to be smushed up like this for that 20 minutes. And I feel like that is a good period for them to have a mass break. I think, it is, I would be in favor of no mass at recess, understanding that there is a risk that is involved in that. But I think they did not specifically say recess.
Any other discussion? Well, if there's no discussion, then we'll have a vote. So this gets complicated, so just to explain to folks in the audience how it works, and just to remind school committee members, the vote we're about to take is on the amendment, okay? So if we vote yes, that means the word recess comes out. If we vote no, it means the word recess stays in, and it does not mean the policy is approved. It's just we're making a vote on the change. We'll do a vote. So, and I'm making my own decision as I speak. I'm just very, I get very concerned. I mean, I see both ways of looking at it. It's just it's that you're dealing with an unvaccinated population, and that's the thing that I am the most concerned about. It's just different. Okay, all those in favor?
Aye.
You raise your hand so I see. 1, 2, 3. All those opposed? No. Passes 3-2. So we go back to the original motion on the table, which is we have a policy in front of us that has been tweaked with respect to the word recess. Any other discussion?
Can I ask for clarification? Mr. Mather talked about the second paragraph in section 7 around the mandatory order and had some concerns about that. I'm wondering if Dr. Auger can clarify that particular paragraph. It's basically saying that is the supersedes paragraph, right? That is the paragraph that's telling us that, that if the governor's mandate or
right
in a situation where he hadn't already, if he was to put something in place, that mandate would supersede this particular policy.
Yes, it's one lengthy sentence.
Yeah.
But in the middle of it talks about my responsibilities, like if there's a spike in the system. But if you take the beginning and you take the very end, it says that in the event of a mandatory order is issued, then you go right to the end, and it says that the district's response to COVID pandemic is to conform with all such orders. So it's in our policy that if a higher authority issues a mandate of some kind, like mandatory masks on buses from the federal government or an executive order from the governor, that's what we do.
And that just applies to the mask policy in particular. So distance learning mandates or any other kind of mandate that comes down, or we have to close the school or anything like that, doesn't apply here. This is just
it says necessary to update the district's response to the COVID-19 pandemic. So anything related to COVID-19 pandemic would apply here.
Okay.
My issue with that is that it's leaving again up to the superintendent and probably the school committee to be making that decision, when honestly it should be made using guidance from the Department of Health and CDC, and not up to us. It's not our place.
Mr. Mather, I absolutely agree with you on that. I have myself spoken to the governor about how I see these decisions to be his. And he has a Rhode Island Department of Health with a group of experts who we pay with our tax money to do this very work. This should be coming from them. You're right. But in the event that it doesn't, then that becomes my responsibility and your responsibility. So I have a problem if we do not get any such orders that now we have a vacuum and no one's making decisions. So,
and to me,
I agree with you on the point you're making.
The purpose of the paragraph, it says a few things. It says, and I'll read it for the benefit of the folks in the audience who don't have this sitting in front of them. It says it's under exigent circumstances, and it says that in the event any mandatory order is issued in this regard, or in the event of an unanticipated change in circumstances, and then in parentheses it says such as a spike in school-related COVID cases in a school or district-wide, in which the superintendent determines it is necessary to immediately alter the district's response, and notwithstanding this policy, the superintendent is directed and authorized to forthwith amend this policy as necessary to update the district's response to COVID-19 pandemic and to conform with all such orders. So to me, that does two things. One is it says that, let's say we had adopted a mask policy 3 weeks ago that said we don't need masks in schools, and the governor issues an executive order that says you have to have masks in schools. The superintendent would not have needed to come back to the school committee to change this policy to conform with the governor's order. That's number one. Number two, it says that in the event that there is a change in circumstance, such as a spike in school-related COVID cases in a school or district-wide, Dr. Auger would have the authority to impose changes to this policy. In my opinion, that would be something that's an additional restriction that he feels is necessary, and he would not necessarily have to wait for the school committee to make that approval. Having said that, we as the school committee would have the power to call a meeting at any time and undo anything Dr. Auger were to do should we not think it's appropriate. So to me, this gives us, if you think back to the pandemic crashing down in March of whatever it was, when everything was changing day by day by day, right? You went to the store one day and everything was fine. You went the next day and you saw someone with a mask and it looked weird. You went 3 days later and 25% of the people had masks. Then they were closed, right? Everything was happening fast. I want to give Dr. Auger the flexibility to react to that with the understanding that if he does something that we do not agree with, we could call a school committee meeting. It wouldn't be an emergency. We'd need 2 days. Call a school committee meeting and change what he did and say, okay, we take this authority away from you. But to me, that's the purpose of this section. And I see it a little differently than you, Mr. Mather. I don't see it as we're giving him the power to do things differently than the Department of Health is recommending or less than. It's what if all heck breaks loose? What if we figure out that, gosh, we've got a giant spike in a school and there's something different about how they do lunch, and we figure out that all the kids who sat at a table all got it, something happens. He can react and make a change without having to come back to us. That's the idea behind it to me. Any other discussion on the policy as a whole? Or any other amendments anyone would like to make to it?
I would like to continue the conversation about this policy. Understood that we're going to be voting on it tonight, but I think amendments still need to be made. I understand the necessity to have a policy in place, and it is my understanding that our current masking policy from last year is still in place. Is it not?
It is.
Okay.
Until this would replace it.
Until something replaces it.
Yes. But it has quirks that it was adopted at a different time. So, for example, it talks about requiring masks universally anywhere on school grounds. So, for example, if that policy were to start again once school starts, you would be wearing masks outside, which we're not proposing in this policy. And it also is from a time when the recommendation was 6 feet of social distancing, so it references 6 feet of social distancing in a number of places. So it's not really up to date with what the guidance that we have right now is.
Understood. My issue with this policy is that it doesn't abide by the recommendations, period.
Yep. And I understand your concern, and I share them. And right now we're governed by the governor's mandate. I have no problem looking at more data. And when I was reviewing this policy originally, either I was misreading CDC guidelines or thinking more of the global rules and thinking that, there were tiers with respect to, numbers in the community and everything like that. That's the part that you're uncomfortable with. I don't know what things are going to look like, how long the governor's mandate's going to last, and it may mean that we need to look at that again. I'm certainly willing to do that. But for now, I think that this is a policy that would work for what we have and what we know right now. Any other discussion? If not, I think it's time for a vote. So we'll do a roll call vote. So if the clerk could please call each member and we'll vote yes or no, aye or no.
Greg Vlasbach?
Yes.
Lisa Hildebrand?
Yes.
Jennifer Hoskins?
Yes.
Jennifer Lima?
Yes.
Jake Mather?
No.
Thank you. So the motion passes 4-1, so the policy as amended is approved. And other than financial reports, if any members have any questions or the disposal report, we've reached the end of our agenda. And I would ask for a motion to adjourn.
So moved.
The motion, Mr. Mather.
Second.
Second. All those in favor?
Aye.
That was Ms.
Aye.
Hoskins, sorry. We are adjourned. Thank you, everyone, for coming.